This week on Healthy Living, we shed a light on the unsung heroes of healthcare, caregivers. And caregivers in Zambia face loneliness and stress. We'll see what is being done to care for their well-being. Plus, research in South Africa highlights the growing need for support systems for caregivers. And a new digital solution offers a path for caregivers in need of a break. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. They play a crucial role in healthcare but tend to be overlooked. Caregivers are often family members who will step in to provide daily assistance to sick patients and the elderly. They take on various tasks like bathing, feeding, and managing medications. Many lack access to proper training, leaving them vulnerable to stress, loneliness, burnout, and financial hardship. In a survey conducted in 2024 in the U.S., 71% of middle-aged Americans said they were caregivers for both their children and parents, a situation experts call the sandwich generation. Global data reveals that in Africa, over 70% of elderly care are provided by family members. Let's go to Zambia, where reporter Kathy Short sheds light on some of the challenges faced by caregivers in the country.
According to the Zambian Ministry of Health, professional caregiving is still in its infant stage. At the moment, it remains a preserve of the rich in the southern African country. A professional caregiver costs up to $4,000 a month, way too expensive for most citizens. The majority of Zambians rely on family members to provide care for sick loved ones. Most of these caregivers have no professional training. Lusaka resident Kelly's Mushota has been a caregiver for his mother, who was diagnosed with stage 3 breast cancer in 2019. Mushota, who is the oldest son and breadwinner, had to take his mother into his home in order to better take care of her. He bore the cost for her care until she recovered. To raise the finances needed, Mushota had to take up 2 jobs and says he barely slept at night.
Our system does not give prior information of what to expect of the process, what's the cost, what's the next stage. So you can never know the cost of the entire process. You only get to look for the money when you get to the next stage. And I think that was very challenging. And it caused a lot of stress on myself, my siblings, and a few other people that were around to help.
Helen Mwale, who is also the oldest daughter, has taken turns being a caregiver for several family members. Recently, she looked after her 96-year-old aunt, whose illness left her unable to walk or do anything on her own until she died.
If I remember very well, I had even stopped going for work because I really needed to dedicate my time 100% to take care of my aunt. We had a few family members who would come in there and then, but not always. But I was 24 hours dedicated to taking care of her.
Happy Zulu is a therapist at Reveal to Heal Medical Center, a privately run counseling center. Zulu says most caregivers do not seek counseling to help them cope with the demands of their responsibilities.
But unfortunately, we have received very, very few people who seek therapy. Because in most cases, people don't even think these individuals exist, or well, they know they exist, but they don't think they need help also. But look, they go through stress, they go through burnout, and they could go through depression as well.
A 2023 UN report indicates that care work is essential for the functioning of households and societies, but it is often not recognized, paid, or appreciated. It adds that more needs to be done to support and recognize caregivers' vital contributions to health care. Kathy Short, VOA Africa, Lusaka, Zambia.
We asked viewers to share their thoughts on caregiving in Africa and how can family caregivers receive support and care. Take a look.
When you have a family member as a caregiver, it's such an advantage because there is no charging fee. He will take care of the sick or the patient at a loving and caring manner. It is time convincing.
Economically, it is an advantage because you don't have to hire someone to take care of your family members. At times, people tend to think like the family members are taking advantage. Mostly maybe they're suffering mentally, you see, and we don't have the knowledge of how to handle someone mentally.
Having a family member as a caregiver in an African household setup, it makes you feel loved. It builds the bond. You don't have to have that transition time, introductory. You get comfortable around them much faster. But one of the challenges is there is no data protection. Whatever you're ailing from is likely to be known by everyone else apart from whoever is giving you the care.
To some extent it is good simply because they have a bond together between the family members, so at least one can care. It's also a disadvantage in one way because you see what happens is that when we give that job to a particular member of a family, we do not consider, okay, you'll feed them, but they also need something. Everybody demands something from whatever they do.
Well, in Africa, the advantages that we incur as family caregivers is that, one, we don't have to count cost because once we are family caregivers, that means we might be caring for our spouses or our siblings or our parents. So we don't need a specialized caregiver. Well, the inconveniences that come with it is that sometimes it can be very draining financially because that has to come from you. Well, this can be very draining. It can be very stressful. And we know that since this is your loved one you're caring for and you have to give it your all, it can affect you mentally too.
Dr. Amina Bintu Muhammad is the Executive Director and Team Lead of Connected Hands for Family Health and Empowerment Initiative. She elaborates on the challenges faced by caregivers and how to improve their well-being.
Oftentimes, caregivers in African homes are women, and it's the fact that it is a thankless and almost an unpaid labor. It takes a lot to care for the sick. However, it is always expected of women to actually do it, and it's been refined in culture. The culture has defined it to be like that, but that should not be the standard because we have nurses that can actually do the services. You could get a housekeeper, etc., that could do the services. I think that our culture takes away the power of choice from women in this kind of situation. Caregiving, no matter how, it doesn't matter how minute it might actually appear to be, is a whole lot of work because you are basically nursing somebody into full health. That takes a lot. It means that you have to probably make sure that. And again, it depends on the severity of the ailment. There are some illnesses that will have you having to bathe the person, that will have you having to help the person go to the toilet, etc. Right? And there are other ones that probably is just you trying to make sure that they get their drugs and they take them in good time. Whatever it is, it takes a lot mentally, emotionally, and even psychologically. If any experience begins to feel like an out-of-body experience, it's time for you to take a step back, to speak up, always speak up, and take a break. Mental health plays such a significant role. I will never ever be able to overemphasize the role of mental health. The mental has to come before the physical. So mental health awareness helps to make sure that these caregivers actually show up mentally, and mentally they are okay. And evaluation is very important, like I mentioned.
Researchers at the University of Cape Town are conducting a broad, multi-country study on the challenges posed by a rapidly aging population, but also the many challenges faced by the caregivers and the institutional changes that need to occur to bridge caregiving gaps.
We need to think about how we care for older persons. Across the world, different societies are aging. Some are aging rapidly, some are already have high proportions of the population who are older. And in different societies, the needs are different. The care needs of the older population are different. Most families across the region can't pay for care. So we got to think about what can we do to distribute that work a bit more evenly and also recognize that work when it's done, particularly by family members. We've traditionally relied upon family members to care for older persons. First of all, it's not recognized. It's invisible work, and we've heard that before. You know, care work is invisible. Why is it invisible? Why is it not recognized? Knowing that families are the predominant carers in society, particularly in the region, what are the consequences of that? What does it mean if we put a lot of the responsibility, if not all of the responsibility, on families to manage individually in private households very complex care needs? You know, women are the predominant carers. That's the same for children. It's the same for people who are maybe living with a disability, and it's the same for older persons. And most of the time that's a family member. It's not just women. So women are caregiving in both paid capacities but also unpaid capacities, and that they're quite different. So we got to think about what can we do to distribute that work a bit more evenly and also recognize that work when it's done, particularly by family members. Is the health system set up so that it attends to geriatric needs? Not just health needs, though. We have to think beyond that. We also think of care needs. We also need to respect older persons. Older persons have given a lifetime to society, whether it's through, you know, their multiple contributions of helping others, of working, of paying in tax, for example. And we want people to live with dignity as they age. We want people to be able to do what they want to do, whatever that is. Some people it'll be to be active, other people it'll to be recognized and heard and to be represented.
The Anais Project is an initiative set up with an innovative system to meet the respite needs expressed by caregivers. This system is based on digital tools and was created by Alexandra Sabin after witnessing her father's experience as he cared for his sick brother. She tells us more.
It all started with my own family's experience when my uncle was caring for his wife who had Alzheimer's disease. And like many caregivers, he eventually fell ill himself, and it was my father who became his caregiver. Anais means helping our elders and caregivers with social media. For example, take a woman named Sophie. Let's say it's Saturday morning, and after 3 sleepless nights, Sophie desperately needs a break that evening. We know that usually no emergency solution is available during the evening on a weekend. So thanks to the Anais application made available via a local partner, Sophie can request emergency respite with just a few clicks on her phone. She is then put directly in touch with a trusted relay, a person who is nearby and available to respond to her request and will go to her house. In fact, we're innovating on several levels, especially when we give power and autonomy to caregivers by enabling them to organize themselves according to their needs, with the guarantee that their requests will be taken care of by reliable people. We also innovate when home-based caregivers are autonomous and responsible in the organization of their mission, and the organizational model is based on this commitment. And finally, we also innovate when partner organizations integrate an optimized organizational framework. In terms of feedback, it's important to distinguish 2 aspects: feedback concerning the service itself, so in relation to the people who come to the home, and feedback concerning the use of the application. In terms of technology, what comes up most often is the simplicity of the application. Users appreciate how easy it is to use and how quickly they can access services. And when it comes to the service, each partner organization is independent and applies its own quality standards. And I'd like to say that for all of this work, values such as collaboration, ethics, and the pursuit of social progress, above all, must be shared by all partners involved.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Elinor Moudou. Until next time, stay well and strive to make every day a healthy day.